Therapies for psychological disorders. So, like the big picture about therapy. So, what are therapists? Therapists are trained professionals who know how to do a couple things. One, establish a helping relationship. Two, apply the knowledge of psychology to an individual struggling with problems and choices. And so when we think about, therapists, a lot of times we think about mental disorders, but it's not always just mental disorders. Right? A lot of times it's people who just don't make good choices. So the cartoon here that you see, this is a very Freudian approach to it. Someone laying on the back, saying whatever coming to their mind, and the therapist just writing down whatever, and you have no idea what they're writing down. So in therapy, we often hear that someone has therapy, but what is therapy? There are many stereotypes about therapy, like the picture of a bearded therapist taking notes while a patient lies on a couch and spills his or her guts. This is a very Freudian image, like what we just saw. So therapy is a term used for any treatment process. In psychology and psychiatry, therapy refers to a variety of techniques used to deal with mental disorders or cope with problems of living. There are endless reasons why people go to see a therapist or counselor, including making difficult decisions, dealing with academic problems, coping with the loss of a loved one, or dealing with an unhappy relationship. So there are a variety of techniques and methods therapists and counselors use, but they all center on developing a strong, supportive relationship with the patient. That's key. Another similarity amongst all therapy techniques is their end goal of changing a person's functioning in some way. Right? So you go to therapy because you don't like the way something's happening, whether it's the way you're thinking, behaving, whatever it is. So you go to therapy to change that. So components of therapy. So in addition to developing a strong relationship between client and patient and counselor, the therapeutic process generally involves some or all of the following processes. So number one, you need to identify the problem. So why are you in therapy? Number two, identify the cause of the problem or the current conditions that maintain the problem. And thirdly, decide on and carry out some form of treatment. So no matter what technique you're using, usually we're going through these steps of the process. And depending on the technique, those treatments are going to be different. Like the plan will be different. So the seven main types of professional help. And so you can see in this chart. So the left-hand column is the title, the professional title. The middle is the specialty and common work setting. And the last column is credentials, qualifications. So I know a lot of you guys are interested in going into some form of psychology. So this is a good little chart for you. So first we have counseling psychologists. They provide help in dealing with common problems of normal living relationships, child rearing, school problems. Typically counselors in schools, clinics, or other institutions. So it depends on the state, but usually you need at least a master's in counseling, but most commonly a PhD. And so you can get a doctorate in psychology without a medical degree, so a SciEd, which is common. Clinical psychologists train primarily to work with those who have more severe disorders, but may also work with clients having less severe problems, usually private practice. Usually required to hold a PhD in a state certification. So if you're going to have your own practice, usually you're going to have a doctorate. A psychiatrist is the next one. They have a specialty of medicine, deals with severe mental problems, most often prescribe drugs, may be private practice or employed by clinics and mental hospitals. So for this one, you need a medical degree, licensed by the medical board. A psychoanalyst, these are practitioners of Freudian therapy. Usually they have a private practice. They also have a medical doctorate. A psychiatric nurse practitioner. So this is a nursing specialty licensed to prescribe drugs for mental disorders, may work in private practice or in clinics and hospitals. So it requires an RN credentials plus special training. And usually you have to pass some type of test as well. Clinical or psychiatric social work. So social workers with specialty in dealing with mental disorders, especially from the viewpoint of social and environmental context. So usually they need a master's of social work. And there's also a pastoral counselor, right? Members of religious order or ministry who specialize in treatment of psychological disorders. And so this varies a lot, um, especially because usually they have a degree in theology or something like that. They could have a psychology degree as well, but that varies a lot. So what are some of the current movements? Right, the world of psychology is constantly changing. One of the current movements is clinical psychologists who are seeking to obtain the privilege to give prescriptions to clients. So they're like, we know what they need. We know if they have depression, the drugs that they need to take, or bipolar or schizophrenia, whatever it might be, but they're not allowed to prescribe it because they don't have a medical license. So some states, like New Mexico, which was the first state to allow this, they put psychologists through this rigorous program, which included 850 hours of coursework and supervised internship. And so, because of that, they were allowed to prescribe medicine. So, not surprisingly, this is a hotly contested in the medical profession. So, psychiatrists obviously don't like it because that's their niche, right? People go to them for drugs. Essentially, they're just legal drug dealers. Um, I mean, they do a lot of great work, but that's what they do. And so now you have these people kind of coming in and making it easier for people to get the medication they need, which most people would think is a good thing. But now psychiatrists might lose business. They might not like that as much. Last time I checked, Illinois is not one of those states that allows this, though. So the history of therapy. So much like the history of psychology itself and psychological disorders, therapy has had its fair share of misguided theories. So if you remember, we talked about the history of psychology and the ancient times and medieval times and how you were possessed by demons. And we talked a little bit about how they would treat them. So in medieval Europe, people often thought mental disorders were the work of the devil and other demons. The job of the therapist was to perform exorcisms. So you had to get the demon out somehow. And it might be by beating it out of them or doing something destructive like that to try to get it out. Not surprisingly, oftentimes it did not work. In fact, they were usually worse off after their, so-called treatment. So Bedlam and its origins. So some of you guys might have heard of this before. So one of the most well-known asylums was that of Bethlehem Hospital in London. So on the weekends, a person could pay a pence, which is like a penny to us, to go sightseeing and watch the inmates who often put on a noisy and wild show. As a result, Bedlam, the shortened term Londoners use for Bethlehem, became a word used to describe any noisy or chaotic place. So, I mean, some of you guys might have heard of this before, and this is where it comes from. So obviously nowadays this could never happen, right? We would never, you could never pay to go watch people in the hospital. I mean, if you think about back in the day, they had that with like the circuses, where they had like the freak shows that would go around and travel with circuses, and people would pay for it. Kind of same thing here. Once again, this would never happen nowadays. Medieval asylums. So in the medieval asylums, patients at most were custodial care, meaning like they just took care of them. They didn't really help them at all. But at worst, they were neglected and put in cruel restraints such as cages and straitjackets. So a lot of times they were actually strapped up where they couldn't even move. A lot of times they didn't get sunlight and things like that. So I mentioned this earlier where, you know, the treatments they had wasn't good for them. It wasn't until reformers like Dorothea Dix in the United States, um, tried to get better treatment, more humane mental hospitals, like maybe having open air, letting them outside, things like that. That things started to get better. Because back then, some even received torture like beatings and cold showers to try to help them out. They thought they could literally almost punish them to act better, which we know now that obviously didn't work. It wasn't like they wanted to act this way. It was a mental disorder that they had. So the modern approaches to therapy, right? There are two main approaches. So psychological therapy, psychotherapy, focuses on changing disordered thoughts, feelings, and behaviors using psychological techniques. They come in two main forms: insight therapy and behavioral therapy. So insight therapy focuses on helping people understand their problems and change their thoughts, motives, or feelings, right? So it's all about the inside. Where behavioral therapy focuses primarily on changing behavior, the way you act. So also, there's the biomedical therapies, right? And this is pretty much just the biological approach that we've talked about. So it focuses on treating mental problems by changing the underlying biology of the brain. So a physician or nurse practitioner can use a variety of drugs, including antidepressants, tranquilizers, and stimulants. Right? So it's all about you have a chemical imbalance. So it's all about changing, you know, the it's all about balancing that out with the neurotransmitters, and you do that by drugs. So another modern approach that I actually saw at a conference that is used often with like teenagers especially is something called DBT, Dialectical Behavioral Therapy. So this is one that might not be on an AP test, but maybe might help you out, right? So especially if you're struggling right now, definitely pay attention to this one and see if there's anything you can do to maybe help yourself out. So DBT is an organized, systematic approach to enhance decision making. So oftentimes used on students with high anxiety, which nowadays is more and more students, as we've talked about. So with this, there's four core skills that you learn and that you do. So number one, mindfulness. It's all about being present, right? It's all about focusing on the here and the now, kind of like a humanistic perspective, right? That just all that we talked about, client-centered therapy. Number two is interpersonal effectiveness, social skills. So it's all about working on your social skills. The third one is emotional regulation. It's about controlling your emotions. We've talked about how your emotional intelligence is the biggest indicator of how successful someone is, or at least more so than your IQ actually. And then the fourth one, distress tolerance. They have something called wise mind, right? So it's all about balance of rational mind, which is problem solving, and emotional mind, which is your motivation. So it's all about bringing balance to your life. So disorders and therapies and cultural. All right, so the way a disorder is treated relies on the way it is viewed. So the way it is viewed is heavily dependent on the culture it is being treated in. So like in individualistic societies like the US, Western views generally regard psychological disorders to be a result of disease process, abnormal genetics, disordered thinking, and unhealthy environmental or stressors. Where collectivist societies, cultures think that mental disorders are a disconnect between the person and the group. So in such cultures, treating mentally disturbed people by removing them from society is unthinkable. So that's what we do in Western society. We take them out, we put them in a mental hospital. In a collectivist society, they would never think about doing that because that is the problem almost, where they can't connect to the group. So you just have to make, they would put more of an effort to connect them to the group. And lastly, how do psychologists treat disorders? So treatments of disorders falls into one of the two categories we just discussed. Insight therapies were the first truly psychological treatments used, but in recent years, behavioral therapies have also become common and effective. In fact, usually it's some kind of combination of the two.